Hello and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blaiklock, and my guests this episode are Dr. Bridget Hempel, who is the Medical Director of our Neonatal Intensive Care Unit with Hardin Memorial Health, and Assistant Professor with the University of Louisville. Welcome. And Melissa Johnson with a very special story and a recent mother. So let's start talking about, I think, the Neonatal Intensive Care Unit and what the difference between that type of nursery and maybe a regular newborn nursery is, Dr. Hempel.
Okay, well, a regular newborn nursery is where your babies go after they're born and they're healthy and doing well, and they're just under observation for a couple of days with mom until mom gets better and kind of transitioning, and then they go home. And the NICU is available in case babies need more help, either assistance with breathing or help with their blood sugars or temperature, and so that does have has more equipment in it and things that they need to help them so that they make a better transition.
And this is a very new service that we have at Hardin Memorial Health for our families. When did the unit actually open?
September 1st of 2015.
So it's fairly new. And tell us a little bit about, I heard you say NICU, that's pretty much what it's kind of called as far as an ease in the name. When we refer to that, what type of babies actually go to the NICU?
Well, we're a level 2 NICU, and so that means in the state of Kentucky, we can have babies that are 1,200 grams or more as far as birth weight, or 28 weeks gestation age or greater. So any babies that are born earlier than that would have to be transferred to a more intensive level.
Now, Melissa.
Yes.
Your story actually starts with two wonderful little young boys right
Yes,
here.
I
And
am.
tell us a little bit about what your situation.
My water broke at 31 weeks and 3 days. Wasn't having any pains or anything. We went to labor and delivery, and they tested, and of course it was my water. And the next morning at 7:46 and 7:47, these two come.
And you were how far along?
31 weeks and 3 days.
3 days. So who do we have with us as
This
our
is
other guest?
Grayson, being a little fussy, and then this is Jackson.
And so at this stage right now, they are how
Almost
old?
8 weeks.
Almost
Next
8
week
weeks
they'll be
old.
8 weeks, yeah.
Okay. So while they were in the intensive care unit, tell us about the team that might have taken care of Jackson and Grayson.
Well, the team that we have in the NICU is comprised of the neonatologist that's covering, which for Hardin is myself and Dr. Norum. And then we have a wonderful team of nurses consisting of our charge nurse and our bedside nurses. And then we have our respiratory therapist. We also have a nutrition specialist. We have a chaplain on board who comes and rounds with us. We have social work, we have physical therapy, and we also have a speech pathologist that works with us.
Now, special needs, for such young babies actually at that time, they're not in a regular isolette. Explain to us a little bit about maybe some of the differences between maybe a normal crib or an isolette that we have seen and what you might have in the NICU.
Well, we do use cribs if they're warm enough and they are big enough, but we have what's called a giraffe isolette. So we sort of call it the Cadillac of isolates, and it's able to warm them. We can regulate their temperature based on what their body temperature is and warm the radiant air up to the temperature they need to maintain their temperature so that they can have optimum growth.
So babies that are born early have maybe trouble keeping warm, feeding issues, and so you might have to have special care, special formula.
Yeah.
Tell us a little bit about that situation, Melissa, for you.
The first time I seen them, they had a feeding tube down their nose, and they were getting fed that way. But they are on a special formula. It's high-calorie formula to help them gain weight. And like she was saying, the giraffe, you can stick your hands in it to be able to touch them, but you still aren't able to hold them until they can come out of that. So that's a little tough, but it was pretty neat.
But very important to have that touch and that contact,
yeah.
obviously, and that's something I'm sure the unit is stressing for the mother-baby contact and or parent contact too, obviously, to be in there and make sure that they have that very special connection. Now tell us about some of what you experienced as far as your interactions with the staff, Melissa.
It was absolutely wonderful. We joke around now and say it's their aunt and uncles. Everybody, if I ever had a question, it always got answered. Dr. Hempel would call, just tell me how they were going if I hadn't got up there yet for the day. And they would just help me out, like if I had questions on, I remember the first time I changed a diaper, they were so little, I was so scared, like I'm going to break them. And they were like, no, they're just like any other baby. So, I mean, they're just like family, everybody there.
You talked about really the communication and the information that you had. You really felt that you built a relationship, it sounds like, with the staff too.
Very much so.
So that's important. So when they're in the hospital, Dr. Hempel, they actually see you. What happens upon discharge with the baby?
Well, once they're discharged from the hospital, they no longer need the neonatologist, at least at Hardin. If they're smaller or less than 32 weeks, we do send them up to the developmental clinic as for follow-up with University of Louisville. I think their appointments are in March. They'll go up. And then they'll see their general pediatrician, who will be with them until they're 18.
And actually you're really looking at developmental progress that they have too, the growth progress that is there too. So I know that's a constant for you, Melissa.
Oh yeah, they get a lot of weigh-ins.
Yes, absolutely. Now, we've been talking about the physician that they see in the hospital while they're there too. Tell us a little bit about maybe with the parents, the interaction that they have when they are able to come into the NICU. What are they able to actually do? It depends on the case, I'm sure.
Well, in the beginning, we do minimize touching. We do what's called kangaroo care, and that's skin to skin. Moms and dads can do it. And for moms, it does help with milk production, and eventually the babies will be able to breastfeed. And this way they can do bonding. They keep their bodies warm. It's actually very interesting that when you put a baby skin to skin, the mother's temperature will heat up to keep her baby at the appropriate temperature. And so that promotes great bonding. And like I said, we encourage dads to do it as well. And I think the dads are a little more nervous in the beginning, but once they get into it, they come in and they're like, no, I want to do it this time.
Very special, I bet, Melissa, for you to be able to do that too.
Oh yeah, I didn't get to hold Grace until he was 3 days old. And then we got to hold Jackson at 4 days old, and it was about 4:30 in the morning, but I was not passing up that opportunity.
Now, when the babies, what's the earliest that they would come to the NICU, and then maybe a graduation time as far as the preterm? They come in at what's the weeks that they might be able to come into the NICU, and then when would they be discharged?
Well, like I said, we keep babies that are 28 weeks or older as far as gestation age. If they are born sooner than that, we would transfer them up to COSARES because they have more equipment that's necessary to take care of those smaller babies. But if they're greater than 28 weeks, then we would keep them in our NICU, barring any other advanced medical issues such as need for surgery or anything like that. And they can come and they can stay with us and they can grow with us, and we'll work on their feeding and their temperature and getting them big and strong so they're ready to go home.
Now, Melissa, for you, we talked about the relationship. What about location? Was that an ease for you to be able to get to the hospital and be there?
Yes. We live in Laurel County, so it takes us about 15-20 minutes to get to the hospital. But like me and my husband talked about, because family was with us the whole time too, if we would have had to went to Louisville, the financial burden just on top of that would have been horrible for us. And then the drive constantly, I honestly don't know what we would have done.
Well, and having your support system, I'm sure, with friends and family nearby, and then being able to be there close, and especially, I think you may have other children at home.
Yes,
too.
I do.
So that's quite important to make sure that you have everybody together and be there. For that. Now, Dr. Hempel, what about medications? We talked about the pharmacy, respiratory, all that is taken care of for that family right in the NICU, correct?
Yeah, we have our whole team, and we have pharmacists that are dedicated specifically to our NICU. And they ran with us every day, and they help us to make their fluids that they need, that has their electrolytes, their protein, and other additives that they need until they're able to eat more. And any other medicines that we do need, they're able to provide for us.
Now, when it was time for you to go home, talking about kind of graduation, was that a special moment for you to be able to learn everything, and the staff was there to help help you through all of that?
Yes. It was actually kind of funny because me and the nurse that discharged, we both cried. She was like, I'm going to miss them, and then just missing them too, because you're so used to being there and their help, and then you go home, and that's when reality really sets in, because it's like, there's nobody here, I can't call a nurse, or Dr. Hempel's not here, I can't ask her this, so it really sets in when you go home.
Did you have follow-up after you went home?
Oh yeah.
They called to make sure everything was going smoothly.
Yes.
I think that's important too.
And actually, I'm friends with some of the nurses on Facebook, so we stay in touch that way as well.
Well, I'm sure everybody wants to see how they grow.
Oh yeah.
And possibly maybe at a milestone, maybe a year, 6 months, a year, see how they're doing?
Oh yeah, I
Check
think
back
every
in?
year we're gonna go up and let them see where they were born, and hopefully the staff will still be there so they can see them, every year too.
Now, Dr. Hempel, I know you have a relationship with U of L and working and teaching also up there too, correct? So that gives us a nice contact to make sure that we're up to date with all the latest and greatest that is happening in the care of babies that might be in a NICU, correct?
Yes, Dr. Norm and myself are both part of the University of Louisville NICU team, and we both go up there and do service weeks up there, as well as providing service down here.
So there's a good continuity of care with actually the standards of care that are out there right now
Absolutely.
too. How many babies actually can be in the Neonatal Intensive Care Unit at a time?
We are approved for 6 beds currently, and we do run pretty full. On average, we have 5 to 6 babies, which is wonderful. And as time goes on, if we prove that we need more beds, we'll be able to ask the state for a certificate of need to improve the number or increase the number of beds.
Now, in the Neonatal Intensive Care Unit too, it is actually set up physically so that they are watched on an ongoing basis because of the windows. And did you like that, Melissa, too? You knew that they were being observed.
And any time I called, there was a password that we had to give just so nobody could call. But it was, I think, at the time when we were there, of course, they took up 2 of those beds, but they were pretty busy while we were there. So there was a nurse, I think, for every 3 babies. So there's always a nurse in there, or if they, had a issue that day or something happened, they would assign a nurse just for them too, and then the other baby would go either to another room or have another nurse.
And I think we need to mention too, those nurses have gone through special training to take
Absolutely,
care and are certified in different areas and make sure their competency levels too,
Our
so that they're
nurses
able to
have
care.
actually gone up to COSARES as well and spent some time in the COSARE NICU. So they've had hands-on experience with some of the sickest babies, and they've been able to bring that experience back to us.
Which is very important, so that transfers in the care right here, and that reassures you to let you know that they were there. But I appreciate you too saying something about the password, because that's very important for confidentiality
Absolutely.
and security, which is highly important when you have a newborn.
Oh yeah, because
newborn
I would
child,
call
too.
at least twice a day, so they got to know who I was pretty quick. And the password we picked, my husband actually came up with when I was pregnant, so we would all giggle every time I had to give it. So it was pretty fun.
Now, tell us a little bit about, while they're there too, they're getting fed, obviously, we want them to grow. A lot of lab work, sometime maybe even respiratory treatments that a baby might be going through too. Are those general, I guess, treatments that might be happening?
Absolutely. In the beginning, when they're first born, we tend to do more lab work initially because we're adjusting what they need. And as they sort of settle into becoming bigger babies, we can back off on the number of labs that we do because they just don't need it.
Well, and that's the only way you really can assess
Yes.
pretty much what's going on inside and make sure that everything is where it needs to be as far as the levels are concerned. So I know you probably went through some different things watching them.
Oh yeah, getting their little feet pricked, and he actually had to have that eye exam after we went home. So that was a little tough to watch, but I mean, you get to know these people and you trust them. I mean, so it didn't bother me too bad.
That's good. That's good. And so we expect nothing but growth, obviously, with these two.
They're very healthy.
And the very special story that you have shared with us at 31 weeks. So really, at this point, they would not have been born yet, correct?
Correct. 40 weeks would have been February 6th.
So this is amazing, to
Yeah.
say the least.
I don't know how I'd have done it.
Yes, and you have a very busy schedule, I'm
Very
sure, at home,
busy,
too.
yes.
Now, how often are they feeding? Quite often?
It depends. Every 3 to 4 hours now. So.
Pretty centered, and I'm sure while they were in the unit, they were being fed quite often, too, to have them grow. And you said, how much did they actually weigh at birth?
At birth, Jackson was 3 pounds 6 ounces, and Grayson was 3 pounds 3 ounces.
All right, and right now we're at?
The last time they were weighed was about 2 weeks ago, and we were at 5'3" and 5'5".
What is general, and that's a good question maybe, what is general weight gain? Just depends, or you're looking for a certain amount?
In the NICU, we do monitor their weight. The first week or so, they lose weight because when we're born, we have extra water on board. It's not real weight loss that they lose. And then they regain their birth weight in preemies usually by 2 weeks. And then after that, we look for a goal of about an ounce a day. So some days you'll see they'll gain 2 ounces, then the next day maybe not so much, or they'll lose a little. But on average, we'd like to see them gain about an ounce a day. And that's what they should consistently gain once they go home.
We hear a sneeze. Bless you. Melissa, you talked about the eye exam too.
Yes.
I'm sure developmentally hearing exam, or they doing some different other types of exams too?
They actually did a hearing exam in the hospital. That's part of before they can go home. But because of their birth weight, they have to get another one. But they can hear just fine.
Yes, but that's standard
Yeah.
usually. I mean, what I was getting
yeah.
is that's pretty much standard in a neonatal intensive care
Right.
unit too. So the eyes, the kind of a whole system check there
Oh,
to
yeah.
make
Eye
sure.
exams are done if they're born at less than 30 weeks or if their birth weight is less than 1,500 grams. So there is a standard by the American Academy of Ophthalmology that gives us when we want to look for vascular abnormalities in the back of the baby's eyes. So if they're greater than that, they generally wouldn't have one done unless their NICU course was telling us that it needed to. There are various reasons we might, but it would be rare.
So that was they were pretty close on their timing there, right? With
Oh,
the
yeah.
31 weeks.
Yeah, Jackson didn't have to have the eye exam done, but Grayson did, and everything was great.
Do they have generally, just depending upon, I guess, the prematurity of the baby, then the follow-up would depend on what's going on
Yes.
developmentally with
Yeah,
each
the
individual?
earlier the baby is born, the more closer we watch as far as developmental and things like that, because they are at risk for more issues. And just because they're born early doesn't mean they're going to have them, but I think we're more diligent or we're more hyper acute at looking for those things. If they're born closer to their due date, they've already developed more in utero, and so they're less likely to have developmental delay and such things. But we still look for it, and the pediatrician's always looking for it. Every time you go to the pediatrician for a visit, that's something that they're looking for.
Now, Melissa, your involvement while you were able to actually visit the NICU, felt pretty involved in the whole care?
Yeah, oh yeah. At first I was too scared, of course, especially the first few days when they had a lot of tubes. But I think after probably 2 weeks, the nurses knew I kind of knew what I was doing. So I would just go in and be like, hey, I'm getting them out of the giraffe. And they're like, okay. And you get comfortable because they're there to teach you how to do those things too. Because being a first-time mom, especially with them that little, I was terrified. But each nurse that I had took the time and they're like, just do this or do this. And they really helped us. They made us very comfortable.
And I'm sure the staff was explaining maybe what was going on as far as the treatment was concerned with that communication, but also what the equipment was that they were using and why it was necessary.
Absolutely.
And Dr. Hempel, I'm sure, was definitely giving
Oh,
you
yeah.
the update on why certain procedures were happening, correct?
Yeah, absolutely. Anytime I had a question, it always got answered and explained very well.
Dr. Hempel, anything else you'd like to add in sharing with our viewers a little bit of information about the Neonatal Intensive Care Unit?
I guess the thing too is if your baby's in the NICU, we're always open. If you have questions, you're at home, call. If you're thinking about them, call. There's always somebody who could tell you how your baby's doing, and don't ever fear just because you're at home that you're not involved with them.
And that's a very good point, because obviously moms need to rest, fathers need to rest, significant others, you know, everybody, the family's totally involved in the care and need to get that rest too. And they know they can call and check in, and that communication line is always open.
Yep.
Well, we appreciate you sharing your special story with us, Melissa, and bringing two special guests here, Grayson and Jackson. And I believe, do we have Grayson?
Dr. Hempel, that's got Jackson.
Oh no, Jackson, and,
okay.
and then we have Grayson over here. So this is very special time for you, and we wish you the best.
Thank
and Dr.
you.
Hempel, thank you for being here with us. For more information, we encourage you to go to our website at www.hmh.net.